Orsi, Director of Public Health and Social Services, Rear Admiral John Manoni, Commander, Joint Region Marianas, and Brigadier General Gentry Boswell, Commander, 36th Wing, Andersen Air Force Base, Guam. And now to the Honorable Lourdes A. Leon Guerrero for her opening remarks.
Thank you, Janella. Half a day. As of today, we have 222 confirmed cases of COVID-19 with 5 deaths. 173 were released from isolation and 44 active cases. Of those cases, 180 are classified as civilians and 42 are military service members. Of the 42 military service members, 35 of these service members are among a unit deployed to Andersen Air Force Base. These service members were quarantined at the Guam Reef Hotel with orders of restricted movement. In an abundance of caution, staff at the Guam Reef Hotel were tested today. Contact tracing is ongoing. Public Health is working closely with our military partners to do close contact investigation. And we are in the process of identifying other locations these service members may have been. While Guam is currently meeting our estimated need for contact tracing based on an NPR analysis, we are currently requesting for more contact tracers through the National Guard and partnering with the University of Guam. If anyone feels as if they were potentially exposed, Public Health is continuing their community testing. You can get tested tomorrow, Tuesday, June 23rd from 9 to 12 at the GPD, the Guam Police Department, Police Coban parking lot next to the Barragata Community Center. On Wednesday, June 24th from 9 to 12 at the Agana Heights Mayor's Office, and on Thursday, June 25th from 9 to 12 at the parking lot between the St. Francis Church and St. Francis School in Jonia. All COVID positive service members have been moved out of our community and are isolated within Andersen Air Force Base. Because of the circumstances surrounding the infected service members, I am working closely with Admiral Manoni and General Boswell regarding quarantine protocol. Let me be clear, all individuals on Guam are subject to the established public health emergency protocols. Our military partners have been very cooperative, and I have been assured that a situation like this will not happen again. I know this surge of cases among service members has alarmed many in our community, but I would like to say that because of your actions, wearing face masks and practicing social distancing, our local cases have remained stable. Based on the data we have, while some restrictions have been lifted, we have not seen a surge in hospitalization, and community testing has not yielded large numbers of positive cases. While we must still remain vigilant, I am confident that our people will continue to do what we know is right. To the people of Guam, I want to say, Sidrus Maasi for doing your part to keep our island healthy and safe. I'd like to ask Linda Dinorsi now to please give us an update of our COVID status.
Thank you, Governor. Currently, we have a total of 222 cases of COVID positive, and 151 are local. 51 are with the U.S. Naval Hospital reported through their DOD lab that they had their test done. 5 cases confirmed by GMHA, 7 cases confirmed by Diagnostic Laboratory Services, and 8 probable cases. So that brings it to 222. As the governor had indicated, we continue to test and we continue to do all our outreach education throughout the community. And again, I request that anyone that has been exposed to someone at home or through close contacts to please go to these outreaches. No one will be turned away. In regards to the current testing that will be done on Tuesday, that will be on June 23rd, as the governor had indicated, in Barragata. June 24th again at Agana Heights, and June 25th in Jonia. In regards to our overall testing capability, we have seen that our cases remain at 222. The age breakdown for our cases are as follows. For 0 to 9, we have 2 cases, 10 to 19, 16, 20 to 29, 30, 30 to 39, 37, 40 to 41, 49, 41, 50 to 59, 37, 60 to 69, 40, 70 to 79 years of age, 11, 80 to 89, 7, and 90 plus 1. So that gives a grand total of 222 cases. I'd like to reiterate that of the 222 cases, we still have 23 that are with travel history and 199 with no travel history. Again, the 199 is as follows. We have 43 with household contacts, um, 43 with community contacts, and healthcare contacts 19. And that's broken down into 5 as a patient and 14 as a healthcare. And no reported contacts 94. And so that gives a total of 199. We currently continue our quarantine sites, and they're located at 3 different areas. We currently have checked in 279 individuals. We also are continuing our isolation site, and we have 1 currently there. As the governor had indicated, we are currently conducting all our investigation in line with the military, working hand in hand with them to identify other cases in the community. Thank you, Governor.
Thank you, Linda.
And now I'd like to turn it over to Rear Admiral Manoni to make a few remarks.
Good afternoon, everyone. We certainly have been through a lot since the first cases of COVID-19 were identified on Guam, and we declared a public health emergency back in mid-March. Now, I'm sure that you're aware that we are fighting through a new challenge at Andersen Air Force Base, which we'll address shortly. But I want to take a moment to recognize how far we've come. Since March, because of the collective efforts of the entire Guam civilian and military team, local military affiliated cases have been very low. The Guam team hosted the USS Theodore Roosevelt and his crew of more than 4,800 sailors, helping them to get healthy and back out to sea. As a community, we've adjusted to the new normal in this pandemic. We've developed local procedures to provide a safe Liberty port for Pacific Fleet ships operating at sea, recently hosting the USS Blue Ridge at Naval Base Guam. We continue to fly missions of all kinds from Andersen Air Force Base in defense of a free and open Indo-Pacific. Locally, we continue to work with the government of Guam, refining our procedures to ensure that military personnel who transfer to Guam are quarantined and then certified healthy before they begin their military duties. Through the conscious discipline that our community has displayed following the mitigation measures such as physical distancing, limiting travel, and wearing masks, we have flattened the curve, leading us to be able to lift some of the health restrictions on our bases. In short, Guam and the CNMI, led by the governors, are seen as a success story in which the community has worked together to beat the virus. Now in a minute, Brigadier General Boswell, the 36th Wing and Andersen Air Force Base Commander, will provide a statement on the situation at Andersen. Before that statement, I would like to ask the community to focus on solving the issue rather than trying to assign blame. There are investigations ongoing, both public health and a command investigation, which will shed light on how and why this situation happened. Today, we don't have all the facts as to how and why, so it would be counterproductive to speculate. We know we have an issue. We are working to find solutions. We need to fix this problem. I need everyone, both military and civilian, leading into this issue and working collectively to get through this like we have over the past 3 months. The same great things we have done since March are exactly what we need to do to continue to do that today. Keep physical distance, wear masks, practice good hygiene, and if you feel sick, stay at home and call your medical provider. Again, this COVID virus is an enemy like no other. We will win if we continue to work together to protect ourselves, protect our families, protect our shipmates, and protect our mission. Thank you. Now over to General Boswell.
Thank you. Good afternoon. As we've discussed, Andersen Air Force Base has experienced a surge of COVID-19 cases among service members assigned to the base. These airmen were initially billeted at the Guam Reef Hotel. All members of the unit have been placed in immediate medical quarantine on Andersen, and at this time are being monitored routinely and are in stable condition with no medical complications. As of Saturday, 20 June, 100% of the unit has been tested and 35 members have tested positive for COVID-19. Due to operational security concerns, we will not disclose any further details on these members or the unit. It is unclear if the members contracted COVID-19 while on Guam or prior to arriving to Guam. We have been in constant contact with the governor, her staff, and working in conjunction with the Guam Department of Public Health and Social Services to deal with this issue as a team. Public health investigators assigned to the 36 Medical Group are conducting information sharing and contact tracing for all service members who have contracted COVID-19 or are possibly exposed. We are committed to absolute transparency with public health's contact tracing efforts to ensure the safety of the local community as well as our military community. These service members receive daily medical screening, and that's how the first case was identified. Members were authorized to travel to and from work and make trips for essential needs under the restriction of movement. All personnel were required to wear protective equipment and adhere to the strict social distancing guidelines. The 36th wing, like the island of Guam, is still operating under a declared public health emergency with restrictive measures and protocols to prevent the spread of COVID-19 within the communities. Preliminary evidence in the public health investigation revealed the possibility that some of these members may not have adhered to the Andersen or local public health directives. At this time, I have initiated a command investigation into this matter to determine the facts. All military members are subject to the established public health emergency protocols. If the ensuing investigation determines that members did not follow these directives in a disciplined manner, I can assure you they will be held accountable for their actions under the Uniform Code of Military Justice. As this is an ongoing investigation now, I will not comment further on that matter. Our primary focus at this time is to care for these airmen and ensure the safety of both our military and our civilian community. We have and will continue to work with the governor and Guam Public Health as we move forward. Additionally, 2 airmen deployed to Guam to assist with the local medical response tested positive for COVID-19. These 2 positive members have also been relocated to Andersen Air Force Base, and the remaining members of that unit are also in quarantine. This second unit consists of medical personnel that arrived on Guam in April to support the expeditionary medical support system operations at Naval Hospital Guam. These medical professionals did not have contact with the unit launched at the Guam Reef, and the cases are unrelated. In summary, the current total of airmen who have tested positive with COVID-19 is 37. Again, all are in quarantine at this time at Andersen Air Force Base. Despite this setback, Andersen remains 100% operational and able to execute all of its assigned missions. The joint team that comprises Team Andersen remains poised and ready to fulfill our mission to maintain a free and open Indo-Pacific region and provide security for the territory of Guam. In closing, we will get through this challenge in the same manner we do as all others. We will work together as a community. We are thankful for the governor of Guam, and the Joint Regions Marianas' efforts to support our airmen and our community during this time. Thank you.
Thank you, General. Before we open up the floor to questions, just want to note that the members to the members of the media, we're not going to go in any particular order. We're just going to go ahead and open up the floor, but we will maintain the questions as one question and one follow-up. So we're going to go ahead and open up the floor to questions, but again, in no particular order. So if you have any questions for any of the members of the panel, you may go ahead and begin. But again, if I may just reiterate, one question and one follow-up, if you can go ahead and adhere to that, just to be fair to all of the members of the media. Thank you.
Good afternoon, everyone.
Thank you, Janella. Hospital Nick Delgado with the Guam Daily Post.
Hi, everyone.
Okay, I don't think it's going to work, Janella. You need to call people.
Right. Yes, please. Again, this is Nick with the Guam Daily Post. So my question was, did the first case from among the deployed airmen get infected on Guam, or did patient 1 essentially bring the infection to the island? And what's the scope of contact tracing that you can say as of today?
So, Nick, as the general had said, there continues to be an ongoing investigation. We have no definitive, accurate findings as to how it started. Both public health, our local public health, and the military's public health are working very closely and interviewing people, investigating, asking them where they came from, when did they arrive, what were their contacts, and so forth. So at this point in time, we really do not have a definitive answer to that, but we are investigating and moving forward with those investigation.
Yeah, we appreciate as members of the community just some of the words that the military officials said to kind of help us alleviate the concerns that have just resounded over the weekend. And so, Linda or anyone involved in the investigation, can we say at this time what, if any, public areas outside of the reef and within Andersen these airmen may have went to, and how many staff at the reef as well at the time the airmen arrived were tested?
Yeah. Yes, we launched a complete investigation with the reef. We started there, and there are 7 high-risk contacts that we identified out of the 74 employees, and all employees have been offered the testing. And as mentioned earlier, they are undergoing the testing. We'll provide some more information in regards to the results of those tests as soon as we get them, and that would be within 24 to 48 hours. In regards to their whereabouts and your question within the community, that again is under investigation through our staff doing their due diligence in regards to close contacts and household contacts and any other exposure potentially if there is in the community. So I don't have that information yet. It's still under investigation, but we will let the public know as soon as we find out. Thank you.
Okay,
you,
I'm just going to go ahead and take back the order. Thank you, Nick. Kevin, I heard you trying to ask some questions, so we'll go ahead and go to you next.
Yeah, okay, and I think it's better that you call people out individually. I did want to ask the governor, first it was the Roosevelt governor, now it's the Air Force. I'm wondering if this latest outbreak has given you pause over the plans that you have for reopening the tourism on July 1st. Will you still go forward with lifting the 14-day quarantine for visitors from South Korea, Japan, and Taiwan?
Currently, the plans that we have in place have not been changed. And the reason is this, Kevin. You have always known that one of the ways that we would change the plans is if we had an increase, and if we had an increase over a rolling 5 days. That's one. The other is that if we see our hospitalization cases going up, then that is concerning because that means it'll impact our ability to provide medical care to these individuals with COVID. That is not the case. We continue to have 0 hospitalization. Additionally, if we were to have a low supply of testing, then yes, that would be a concern. And then, of course, contact tracing. We still have the capacity for contact tracing. In fact, we are increasing our personnel in not only just contact tracing, but surveillance, because we now have self-home quarantine, which is in the numbers of 700 plus. And so the plans to open tourism on July 1st remains. We'll see what happens in the next 2 weeks. Because if those metrics that I just said change any to be alarming, then yes, plans will change. But right now, we are moving forward with opening tourism on July 1st. And we're also looking at, in the next couple of weeks, opening other business activities and other places that are still considered closed as of today. And of course, the other plan was to go into PCOR 3. There's not been a definite date for that, but we are still looking. I just want to say and assure the people of Guam that our infection rate, even with the increase through the military, still remains below 1%. That is still really amazing. It's still a good sign. We continue to contain our virus infection. to the minimum numbers. But again, this will not be sustained if we do not continue with wearing our face mask and social distancing. I have been out in the community, and it's comforting to see everyone that I have met out in the community, and I met quite a number of people in social gatherings of 25 or less, and they are wearing their masks. That when I go to the grocery stores, they're wearing their mask. We have to do a little bit more in social distancing, but we are a very loving community and we want to just hug each other. But social distancing, I think, could be improved. But wearing mask is very, very encouraging, and we need to continue that. Wear your mask, social distance, wash your hands, sanitize, and I am also very impressed with the way the restaurants are adhering and complying to the guidelines. I think bars, we have to work a little bit with the bars in terms of social distancing. And, it's a little bit difficult because people go to the bars to socially contact. But social distancing is a challenge, but people are trying. They are trying and it's working. So I just want to encourage our community to please continue on and to remind everybody near us, because that's the only way we can continue to contain our virus.
Thank you. As a follow-up, I'd like to ask, I'm sorry, Linda, go ahead, please, if you had
Yeah,
something.
I just wanted to interject. The governor is absolutely correct in all the preventive measures. I also want to emphasize that even though those of you out there that have been tested, please don't let your guard down, thinking, "Oh, I've been tested. I'm fine. I don't have COVID-19." Always be aware that even though you're tested and you are negative, be absolutely certain that your guard doesn't go down. Practice all these precautionary measures. As the governor had indicated, washing your hands is so critical, so important. Social distancing, everything she says, don't touch your eyes and your mouth, wash your hands first. And those are the only prevention areas that we cannot say over and over and over till we turn blue in our face. It is so critical. Don't ever let your guards down. And that's exactly what all my staff are emphasizing in all the media, because we have to continue to practice these safe measures.
Thank you. As a follow-up, I did want to ask you, Linda, a little bit more about this incident at the reef. I gather from the statements from General Boswell and General Manoni that they're not going to discuss this incident further. But you did confirm for us and other media over the weekend that there had been a breach, that some of these airmen had left the Reef Hotel and visited establishments in Tumon. Can you tell us a little bit more about that? And why in particular were the results from Andersen released piecemeal? It went from 1 to 7 to 8 to 15 and then to 35 on Saturday. Why wasn't this all reported up front initially when the breach occurred?
Yeah, Andersen can answer that question. Go ahead.
Yeah, so based on the
They
testing,
said they were going to.
what we had at the end of the day results. So the stair step you're indicating that walked up eventually to 35.
We're not hearing the general, no audio from the general.
Gotcha. Can you hear me now?
Yes, we can hear you now.
Sorry, I was just practicing my lines, Kevin. So what you're seeing is just a stair step of time it took us to get through 100% testing and get the results on everyone in the unit. And we were reporting those results real time as we got them. However, I would just walk you back to the first day when we had the first case. We had put everyone on restriction. And then once we had the positive on 2 cases within 24 hours, we moved everyone to Andersen Air Force Base into medical quarantine just to be safe. But that delay was just a basis of the time it took to process the 100% testing of the unit.
Yeah, and I just would like to add, as our staff are doing contact tracing and investigation, We're hearing bits and pieces also. And so we are just trying to gather as much information, and that's exactly what we're doing. We're still gathering information.
Thank you, Kevin. Mariana's Business Journal, Maureen Muratita.
Buenas, everybody. I have a question for the governor. Can you hear me, Gov?
Loud and clear.
All right, thank you. So Bill 32335 passed the legislature on June 15 unanimously. That is the one with tax exemptions in the Dave Santos Act, retroactive to January for 2 years, and it raises the ceiling of the tax exemption. Will you be signing that, ma'am?
You know, Maureen, I haven't seen the final bills. I know they came out late last week after the session. So I am going to be reviewing all of the bills, but and if I see when I see it and I feel that, you know, it's within parameters and there's no legal questions about it, those are some of the considerations that I have in terms of its ability also to be implemented. Then I will sign the bills, but I can't specifically say for this one, Maureen. I haven't really seen the details, nor have I gotten a briefing from our legal counsel.
Okay. My second question also goes to the governor. You referred to gatherings of 25 or less, and we're also dealing on Guam with a 6-foot distancing. Other places are increasing the number of gatherings and reducing the distance to around 3 feet. When can we see some progress like that, ma'am?
I think after this next 2 weeks, Maureen, if the numbers remain as low as we are seeing, that will probably, those parameters will probably be changed, yeah.
To what, do you think?
I would probably look at, you know, if I had it, I'd like to just not even have a limitation on the social gatherings, but I prefer incremental of those gatherings. So I would probably do 50 to 50 for social gatherings. The social distancing, you know, if you listen to also medical experts, they still would prefer 6 feet because they talk about the trajectory of when you sneeze, you know, versus an adult versus a child. A child's trajectory of the sneeze is not as long as that of the adult, and they measured this. The adult still remains at 6 feet. So I would probably do something on the social gathering numbers.
Thank you, Maureen. Guam Daily
Thank you.
Post, Heidi Gilbert.
Good afternoon, Governor.
Good afternoon.
Will the 33 million unemployment benefits be paid today? What was the award from the Guam Department of Labor and the Department of Administration? And also, given the delays in getting the unemployment program started and the payment released, what could GovGuam have done better to get money quicker into the hands of people who have been unemployed for more than 4 months now?
Okay, so to your first question, it is 35 million, and we probably expect either sometime this afternoon or tomorrow. We had to work out some technical glitches with the electronic transfer, but those have been corrected and it will happen. I also wanted to say that a government of Guam have worked quickly to try and get the monies into the hands of our people. If you recall, in the very beginning, we advanced about 11 to 12 million dollars of the of the economic stimulus, and we also increased our Medicaid requirements in their income poverty levels, so we could give money out or provide medical care for our people. We worked very closely with the utilities to try and not cut off people from the utilities, both water and power. We worked as quickly as we could given the resources that we had. And given the fact that the federal government also took a while to provide the guidelines that we had to follow in order for us to distribute those monies. So I want to assure the public that the delays, in if there were any, is not at all because we did not want to get the money out into the hands of our people. We've tried everything that we could legally get it by doing advance payments, by working around some of the expenses so that we could help our people. They now have in their hands the economic stimulus. They also have the program Salapi. Once we got the CARES Act 117 million, we also provided our own local programs to give those money out, and totaling about $50 million that we have are in the process of giving out by local programs that we use to give to the people and use the CARES Act, the $117 million. Additionally, Heidi, as you are aware, we also have we quickly did the first thing that went pretty quick was the Paycheck Protection Plan, which was the loans that small businesses could get. And I think to date, we have over 1,000 businesses that have taken advantage of that, to the tune of about $150 million, $190 million. And we also had the economic injury loan. We had the disaster loan programs. So there was a lot of opportunities out there, financial opportunities. And in working with the federal and our local, we worked as expeditiously as we could, given, again, the legal parameters, the guidelines that we had to comply with, and the certifications that we had to comply with, the approvals that we had to wait for weeks and weeks and weeks, both in the economic stimulus plan and in the pandemic unemployment benefits. So I want to again say that we worked quickly to get the monies into the hands of our people.
Thank you, Governor.
Did you have a follow-up question, Heidi?
Yeah, Governor, this is about homelessness. So Paseo has turned into an encampment of many homeless. What's the plan to solve this problem, long and short term? And is the homeless problem the reason why the most recent Parks and Rec director, Mr. John Birch, didn't last in his job?
All right. So the homeless, our immediate plan right now, let me just give you a little bit of a history. Initially, what we wanted to do was take the Paseo and put tents in there for the homeless. Our information from the coalition and also from public health is that that is not satisfying to the guidelines and the public health requirements. So we had to have a hardened structure. As a result, we have gone out on an RFP, a request for proposal, to get hardened structures. We are in the process now of awarding it. We have identified a few of the facilities that came to the table, and we will short term be moving these homeless individuals. But you know what, Heidi, I don't want to just move people and just leave them there. what I want to do is I want to do a wraparound service so that we can provide for their needs. Many of these homeless have mental health challenges. Many of them are also maybe drug addicted, substance abuse. So we want to provide the services to them so that they can, start rehabilitating or coming back to being a productive citizen of our community. So those are the services that I want to also provide, and not just the facilities. I want to provide the social services, the mental health services, and the medical services that we need for our homeless population. John Birch was not removed from his job because of the homeless program. In fact, I just want you to know that John was very instrumental in working with the homeless to try and get them a place that they can to have a better well-being and better life. And John Birch was part of the program, and he actually was the one that started alerting the homeless that they would have to be leaving where they're at to go to these facilities. And he informed them that we would have to get the facilities first. So his position was not removed because of that. I don't see that is the reason. No. We needed him somewhere where I think is also just as significant and important for the skills that he has.
But Governor, just to follow up, up to how
Heidi-
many how many homeless people would be accommodated in this building that you were talking about?
So we're not just going to have one. We're going to have two, and a combination also of residents. Homes that maybe if families are homeless, that they would then be allowed. I don't have the exact numbers, but we're working to be able to accommodate those that are truly homeless. And if you know that homeless definition isn't just a person that has no shelter, it also includes substandard homes. So that is also included in the homeless definition and for homeless population. But we're looking at the ones that have no homes.
Thank you,
Thank you,
Heidi.
Governor.
I-94, Thomas Manglotnya.
Afternoon, Governor. How are you?
I'm very good.
I just wanted to ask
thank
the
you.
panel today about the reef hotel workers. Were the 7 high-risk reef hotel workers symptomatic or asymptomatic at the time of today's testing? Can you explain how they were determined to be high risk, and why is that when a teacher tested positive for COVID-19 at St. Anthony's, DPHSS shut down the school until further notice, but reef was not? And in not doing so, how is that not creating the potential risk of exposure to others, considering the fact that you're in the middle of a contact tracing investigation right now? Do you feel the people of Guam deserve to know where these service members were deployed from? How many of them were at the reef hotel? How is this information not being shared with the public?
I don't think that's correct that the information is not being shared. I just shared that there were some high risk, and I just shared that there were 74 employees, and I also shared that we're doing the testing. Now, as far as your question about shutting down St. Anthony School, we didn't shut down St. Anthony School. The incubation period between that time where that person was positive has already lapsed, and that person has been deemed cleared, and that is the reason why. The only reason why the outreach was located at St. Anthony was because we wanted it originally at Tamuning, but the mayor was undergoing some type of construction at her area, so she was the one that coordinated with the school to utilize their facility because they had a huge parking area. So I just want to make that very clear. Now, in regards to our contact tracing and follow-up, we are doing the investigation. This investigation takes a lot of effort among all our staff, and I've already mobilized as many staff that I can to begin to make this a top priority. And I assured the governor that it will be a top priority. And as we continue to journey through, as the governor had indicated, we also have beefed up in terms of having more contact tracers. And that we're also going to get through the National Guard, and we're working also in line with the University of Guam. So in regards to what I also said earlier, as soon as we get all the information, we will be announcing any potential risk or anyone who has had contact or they don't want to step forward or be tested, that we will make announcements just like we've done in the past. If there are any potential clusters that develop within the community, we will notify the community and keep them well abreast. I think the Department of Public Health has been very, very good in regards to providing information. We just have to be careful of the type of information we provide so that we don't violate HIPAA. And we also have to be very diligent in that we continue our investigation and that there is a lot of cooperation between those that are involved and the community. Thank you.
All right, thank you so much for clarifying. I wanted to ask now and shift to asking a question to the governor. Governor, what's your comment on the investigative subcommittee being formed by the U.S. House Ethics Committee to probe into allegations against Delegate Michael Nicholas? In a separate posting that you might have seen, he also wrote a Father's Day message. He said in that posting, "I'm firmly resolved to shorten this labor of love if the people of Guam do not resoundingly change out of the incompetence of local leadership." What's your comment on these developments and that message that was sent to the people of Guam by the delegate?
So my comment is, it is a very serious situation when you form a subcommittee to investigate allegations. So I'm very concerned about that. I really don't have any position either way, only that the process will go through. And whatever the recommendations are from that subcommittee, it will be then referred to the greater committee, and then decisions will be made. I do hope, for the sake of the congressman, that this goes by quickly so that there can be answers. I think that he needs to be accountable to the people of Guam in terms of whatever the findings are. And lastly, I don't really believe in this whole incident and in this whole administration since we've started, and also with the senators, that there are incompetent leaders. I think everyone who has been elected to public office are serving in the best interest of the people of Guam. We are working very hard here to get through this COVID, and we have been communicating very closely with the federal government. I myself have been working very closely with the White House. I know that Speaker Barnes has been working very closely with the National State Legislative Council. I know that our directors, most of them have been working very closely with their agencies. I know Dave De La Sola has been working very closely with the U.S. Department of Labor. I know Daphne has been working very closely with the U.S. Treasury. And these are competent leaders, and these are leaders that have brought results to the people of Guam. As a result of the hard work of our DOL here through Dave De La Sola, we stood up a pandemic unemployment insurance program in a matter of 12 weeks, which, by the way, the U.S. has already been in this program for 80 years. So how competent is that? That is true competency. So the statements that Congressman Mike Nicholas has said about the competency of the leaders here is totally incorrect, very untruthful, and I think he should apologize to the people of Guam for that statement that he has made. And what that has done is it has put doubt on the people of Guam's trust for our leaders. Our leaders here work hard, and I expect our federal leaders to do the same.
Thank you, Thomas. Pacific Island Times, Johanna Salinas.
Half a day, everyone.
Half a day, Joanna.
Half a day, Governor. So my question is related to the airmen in the Guam Reef Hotel. So I would like to ask about the infected hotel workers. those that 7 that have been tested. So if they test negative, do they still have to self-quarantine?
Now, if they test negative, then when you ask, do they have to self-quarantine? I would just say that anyone that is testing negative, they still may be exposed. The incubation period is anytime between 2 days to 14 days. And the virus normally develops on median at about 4 days, 4 to 5 days. And more than 96% of the viral infection will occur maybe between 11.5 days thereafter. And so when they're in the incubation period, it is a time where they are infectious. And having symptoms along with this time period, they are definitely very infectious. And so that is the reason why they still need to be under quarantine. And when they are in quarantine, they are to stay home. Limitation of movement. If their home is not conducive, then we move them to the Government of Guam quarantine site, where they will be provided whatever assistance, such as being fed and also having their laundry done and cleaning done for the hotels that they're at. So yes, your answer is they still need to be quarantined for 14 days.
Okay, so my next question is related to the hotel again. So that hotel, the restaurant is still open to the public. Is public health monitoring that restaurant at the hotel?
Of course, that is our job. Our regulation is doing just that. If I feel as the director that anything is not confining to the health of our people of Guam, rest assured I'll shut things down and I'll get the approval from my boss, which is the governor. I will not risk this public for any of that. And that is my job, to ensure the safety of this community. And so we are on top of it. We are doing our due diligence with my staff being out there to do their job. And yes, we have a containment branch that is responsible to ensure that any risk of any possible exposure or contamination is contained. I hope that answers your question. Does it answer your question?
Yes, thank you.
You're welcome.
Thank you, Johanna. KUAM, Nestor Lecanto.
Thank you, Janella. Good afternoon, everyone. My question is for General Boswell. General, from what we've been able to gather, there was a deployment from Dyess Air Force Base in Texas to Andersen in early May, 3 B-1 bombers and 200 servicemen to support that mission. Although a 4th bomber went to Japan, I believe, before that, and then came to Guam. Can you tell us if this is the unit that we are talking about here? And also, when they arrived, were they made aware or even ordered to abide by restrictive movement protocol? And apparently, did they disobey that order?
So let me start. The Bomber Task Force is not the unit we were discussing. They redeployed 2 weeks ago. But to answer your second question, all military units coming into Guam, no matter what their service, are required to follow our public health protocols. There is a reception process, regardless of where they come through Juan Pat, whether they come through the port or whether they come through our air base. So for us, we know the process of bringing them in is one of the things we're evaluating. But based on the fact that we've gone 4 months with only 4 cases in our population, we're pretty confident that our process works. It's the disciplined adherence to the protocols that will be the scope of the investigation.
So if you have advised them of the restricted movement protocol in particular, and they disobeyed that, so that they would be subject, as you said earlier, to the military code of justice. So where is this unit from, and how many in the unit?
We're not going to discuss that. As I mentioned in my statement, we're not going to mention any of that due to operational security concerns.
as a result of what may have happened, and this could go to Admiral Minoni as well as JRM, are you planning any changes, modifications to the policy with respect to restricted movement, in particular for units that are deployed from out of Guam who come here?
Esther, we're working closely with the government of Guam and Department of Public Health, and we're constantly evaluating our processes and procedures to ensure we've got it right. There's never been a time that I know of in the military that we've had it perfect the first time. So we continually work through this, and we're teaming with Department of Public Health, the local government, the different bases to make sure we evaluate this over and over to make sure we get it as best and as tight as possible.
And if I can get one,
Nestor.
can I get one more question into the governor?
Sorry, Nestor, just to be fair to everybody, we're going to keep it at one question, one follow-up, but you can certainly send any follow-up questions my way and we can get it answered for you after the press conference. Thank you. PDN, Anamita Kaur.
Good afternoon, everyone. So I understand that Air Force personnel somewhat regularly stay at the Guam Reef Hotel. So to further Nestor's question, I am wondering if, given this incident, if future Air Force units will continue to be allowed to stay at the Reef Hotel or other Tumon hotels during the duration of this pandemic.
So Ananita, this is John Minoni. So we're working through all of that with the governor, her staff, the Department of Public Health, and we're looking at it region-wide to make sure that we're doing right by everyone inside the fence lines of our bases, as well as the community outside the fence lines of our bases.
So there's no definitive answer yet, to clarify, as to whether or not future Air Force personnel will stay in Tumon hotels.
Again, we're working through that right now.
Okay, thank you, sir. And for the governor, shifting topics, I understand that you are so far sticking by the plan to lift mandatory quarantine for tourists by July 1st. However, can you speak more in depth as to what tangible measures are in place to prevent an influx of COVID-19 cases due to the opening of tourism?
So the tangible measures would be ongoing community outreach for contact tracing and outreach for testing. That's very important. We need to monitor our community spread out there. That would, I think, continue on for a while. And additionally, I think the most very critical of these measures is always wear your mask when you're out, and also to continue our educational outreach of what to do to prevent ourselves from getting COVID, and to also prevent others, our families and friends and loved ones, to protect them also from COVID. So contact tracing, testing, adherence and compliance to already proven preventive measures. That is also the responsibility of our community. Most importantly, the responsibility of our community. And I will never cease to say that it's because of your participation and, of course, your compliance to the directives that we have put forward has made us come to this success and outcome of a very contained, very flattened curve in terms of COVID-19.
So there will be no testing of incoming tourists.
The discussion about testing is still being very much debated and discussed within the physicians advisory group. So that's still up in the air, but I think chances are that if we can expedite and make it a lot more efficient, that might be the course. But for now, it's still being discussed and debated.
Thank you, Anamita.
you.
Governor, would you like to make some closing remarks?
Oh, okay. Again, I'd like to thank Admiral Manoni and General Boswell and Linda for their information to provide our public with assurances and to provide our public with updated information and to let our public know what exactly we are doing to continue on protecting our community and protecting our people from COVID virus. I just also want to say that the measures we have put in place has been, I think, amazing. And I know that there has been comments made from a national level that our measures that we have instituted and the work of our public health and the work of our community gives us a very high ranking mark in grades in terms of our ways that we have instituted very quickly, very rapidly, very, I believe, efficiently, and that we are out there working very hard again to contain. I also would like to say that now that we are in the recovery mode, that we are looking at helping and assisting our economy to get back on its feet. And without the help from our federal partners, and without, again, the work that we have done in communicating with our federal partners, and by federal partners, I mean the White House, I mean US Treasury, I mean US Department of Labor, I mean the National Guard, I mean the Department of Defense, I mean the Secretary of the Navy, I mean our congressional, the Speaker of our Congress, members of Senate. Those are our federal partners that have helped us and are continuing to help us during this economic recovery phase, not just economic, but also our health and safety recovery. Also would like to say that our other partners are your Small Business Administration partner, and also HUD. Just all these agencies. CDC is a very close partner. FEMA is a very close partner. The help and assistance has been tremendous. I also would like to say, because of our competent leaders, we were able to bring in about $1.2 billion in financial aid. And because of our competent leaders here, we are able to infuse that money into the economy. And because of our competent leaders, we are quickly coming up and growing back our economy. And because of our competent leaders, we have developed some very good strategies and programs to diversify our economy, and also working very closely with competent leaders in GVB, the airport, the Port Authority, and all the different agencies with the competent leaders that we have to make sure that we return back to normal as we can. So I just again want to say thank you for your participation, your support, your patience, your understanding, and your help in making us where we are today. I just cannot overstate the cooperation and the community partners together with all our competent leaders. Thank you, and Sidzus Masi.